How's it going, everybody? As the Daybreak show continues in here, we're happy to have in studio Dave Windom from Mason County. Good morning, Dave. How you doing?
Good morning. Very good.
So we've got a big event here happening statewide in just a few days. On the 30th, the governor is finally going to reopen Washington, asterisks.
Right.
And that's kind of what we're here to talk a little bit about. So tell us about what we're anticipating for the 30th, how it's different from where we're at now, because a lot of things have opened up a little bit more, but more is on the way.
So we don't have anything in firm guidance yet, but what we're expecting is to see capacities opening up. So where you're at 50% now, you should be able to open up to 100%. The governor's talking about not removing the mask mandate, though. So that mask mandate is through the Department of Health, through the Secretary of Health, and that will stay on indefinitely, or until the CDC changes their guidelines.
Oh,
so,
wow, okay.
So we're looking at how do we implement a complete opening, what does a complete opening look like, and then how does that mask mandate fit into that?
Sure. And so if we're looking at those 100% levels, does that go through everything, including church services that had been heavily limited, early on in the pandemic? Folks will be able to fully return to religious services as well?
That's what we're anticipating. And, I think the data recently helps bear that out. We had Memorial Day come and go, and we expect a bump usually after holidays, and we didn't get that bump this time. So I think the vaccination rates being up is certainly helping the whole process. How
are the vaccination rates in Mason County? Are more and more folks rolling up the sleeves? Have you seen the plateau, or where?
Yeah, we're kind of at a plateau. We're at about 53, mid-50s percentile on vaccination rates. And I think we're hit that plateau. I think we're going into kind of like a steady state, and I have heard that as the vaccines are federally approved, they get their FDA approval, that more people will get vaccinated. Some people are just waiting for that final FDA approval.
Oh, as opposed to emergency use authorization,
right,
that they're currently at.
Right.
Oh, okay, so once they get the full yes, then they say, okay, well, we're past those points. Interesting there. And so with the masks, how would that work in county government, in Mason County, if you were to go down to the office?
So we're working on that. In fact, on Monday we should be getting that finished up. Basically, we took the LNI guidelines, which is DOSH 1.70, and they inserted a new paragraph, paragraph E. It's a big paragraph for employers, and it outlines what an employer can do to get people out of their masks. So the employer asks the employees, if you want to get out of your masks, you need to see your supervisor, and then provide either your card, your vaccination card, or sign an attestation. Have a note from your doctor saying that you've been vaccinated, or you can pull it down off of the state website showing that you've been vaccinated. And then you can unmask. So of those things, the employer's not supposed to keep copies of the cards, just the attestation.
Okay. Okay. And if there's some in an office that want to stay masked and some that want to stay unmasked, is that still okay, or is it going to, is it basically the employer? Can they force somebody to not wear a mask?
Nope. In fact, the guidance from LNI says you cannot force somebody to unmask.
Okay.
So if somebody is comfortable wearing a mask, they can continue to mask. It's their choice. There are protections in place for that.
What about when it comes to the reopening in the county and the return of more of the employees there? How has that come back online? Have more and more folks in the county have come back to the office, or are you guys seeing more the ability to work remotely if that works?
Well, it's been an interesting experiment over the last year. So in some places, remote work has worked very well for us. In some cases, it's actually increased productivity. In other cases, a lot of county offices are public facing, so you need people at the counter to help the public with their issues. So it's kind of a mixed bag on that. I see most of the county coming back.
Yeah. Okay. We have at the end of the month a couple of opportunities for folks to kind of just feel a little more comfortable, get a little more information to be reopened on the 30th. Tell me about that.
So we're going to have two forums. We're going to have one based out of Shelton, one based out of Belfair. It's going to be a combination, hybrid of Zoom and an in-person meeting. We're putting together a good panel. So we've got Scott Lindquist, the state epidemiologist, is going to be available to talk to people really about what the disease is, how how it's progressed. The guy is really good with science, and he's very good at explaining it to people. We're looking at bringing in a mental health professional who can talk to people who have fears about, I'm afraid to unmask, and other people who are afraid of whatever. So we want to talk about the fears that seem to be kind of dividing our community. We're going to be bringing in some business representatives to talk about different business sectors and what reopening is going to mean to them and how they're going to reopen, and then talk about what things business owners can do to ease their reopening and what things they can expect.
Are there any thoughts or conversations down the road after June 30th if something and numbers start to trend up? I mean, we're at about 75 per 100,000 now in the county, and that's well low compared to some of the higher numbers in the peak of this. But is anybody started talking about if either the variants start to be non-effective by the vaccines or the numbers go that we may have to ever go back to these restrictions?
I think that's always a possibility, but I think the probability is getting lower. So with each vaccination that's given, I think the probability drops.
More and more people are learning more and more about these. I was reminded that, you know, a year ago or better, we were encouraged to wipe everything down and, you know, sanitize everything and bleach everything. And eventually the CDC had enough research done that they said, well, you don't necessarily, there's very limited transmission by touching.
Right.
And so that kind of moved off, and it was concerns about being outdoors, and then everybody kind of said, well, if you're outdoors, it's very low probabilities and things like that. So the more we learn, and I'm sure for you, you get these notes all the time on things that people are learning and how that can help shape the reopenings.
Oh, absolutely. You know, we did locally just a little quick math problem. So if you're outside and you pass somebody on the sidewalk, there was a fear that you would transmit, right?
Exactly.
And a contact is defined as, you know, less than 6 feet unmasked for more than 15 minutes. And two adults walking past each other on the sidewalk are within 6 feet for less than half a second.
Yeah.
So some of the things that came out early on, we said, you know what, the math just does not bear this kind of response.
Yeah, I remember being on walks on the trails and near my house, and I'll see somebody down the way and I don't normally would have had the mask on outside, but you'll see them down at the end of the path or something, and they'll grab for the masks and cover, and it takes longer for them to get the mask on and move out of the way than it would have taken for us to pass by.
Right.
That's amazing. Dave Windom, Mason County Health Director and Community Services Director, is working hard not only on this, but all sorts of other aspects of county life. I had Alex Pacey on this week. We were talking about the shellfish and all the reopening there, and then the work that Ben Johnson has been doing with the Substance Use Coalition. So there's still a lot that Mason County and that your departments are working on, and this has just been one major aspect for you for the last year and a half. So be on the lookout for those forums, the 29th of June and the 1st of July. The 29th is going to be in Shelton, and the 1st is going to be up in Belfair, and you'll be able to jump in on that Zoom call, get some good information by qualified representatives, and opportunities to ask some questions. Dave, thank you.
Thanks. Appreciate coming in.